Thanks everybody for being here tonight. I'm really excited to share this information with you. So we decided to title this talk, "Is Sex Good for You?" Because when we look at what people are Googling about sex, this is one of the top hits. So we decided to start there. See if my slides don't seem to want to advance. Hold on. Jeff, do you know why they won't go forward? Oh, there we go. Had to be patient, I guess. So before I start, I want to give a bit of a disclaimer. Tonight, we're going to be talking about sex and celebrating all the good things about sex, but I wanted to just acknowledge that we live in a country where women's bodily autonomy is currently under attack, and where women, trans folks, and queer people experience high rates of sexual violence that can also impact our experience of sex. And some of us, or maybe most of us, grew up with some patriarchal and religious messages about sex that can influence how we approach sex. And I see many folks in my office for whom this is present, and I always recommend that they seek additional help from a therapist to work through these realities. And although it's outside the scope of this talk tonight to talk about those issues, I just wanted to acknowledge that they're very present for people. Additionally, we know that our experience of gender and sexuality is very individual. And this talk is focused on women or folks who have vulvas, vaginas, and uteruses. And when I say the term women, I'm mostly referring to people who were born with assigned female at birth and born with female body parts. But because that's what generally has been studied in the literature, and that's what we really know a lot about. But what I know also is that we have a lot to learn about folks who identify as trans or gender fluid. So this is just a beginning of a conversation. So let's jump right in. Is sex good for you? What we know is that there are many researched benefits of sex, and I've listed some of them here. Lower blood pressure, better immune system, better heart health, including maybe a lower risk for heart disease, improved self-esteem, decreased depression and anxiety, increased libido. We know that the more sex we have, the more interest we cultivate in sex, immediate natural pain relief. There have been studies to show that if you have an orgasm while you're kind of feeling a migraine coming on, it can help end the pain of your migraine, which is pretty amazing. Better sleep, increased intimacy and closeness to a sexual partner, overall stress reduction. So sex does have a lot of great benefits. And we might wonder, how do we get these benefits? If we don't have a partner, can we still experience these benefits? Yes, in fact, that you can. If orgasm is available to you, having an orgasm on your own will still give you all of these fabulous benefits. If orgasm isn't available to you for whatever reason, and you do have a partner, intimacy and touching and closeness also can bring some of these benefits. We might wonder how this exactly happens. And what we know is that during sex and intimacy, our brains create a cocktail of neurochemicals, almost like opioids, that bathe our entire body in kind of feel-good hormones that result in all of these good benefits. We also know more and more about the female orgasm, and a lot of that information we have to thank this person called Dr. Nan Wise. She was a sex therapist who went back to graduate school in her 40s to get her PhD in neuroscience, which I think is amazing. And she decided to study orgasms in women. And what she did was put women in an MRI machine and have them have orgasms. And she found out that orgasms are a full brain event. So you can see over here this MRI of someone having an orgasm, and their whole brain is lit up. Now, if we were to do an MRI on someone doing other activities, say like walking or talking, there would be just one little part of the brain lit up. But what we know is that when we have an orgasm, it impacts our entire brain. And when we do this, it connects different parts of our brains that might not always work together. It's really kind of the best exercise for the brain. Just like I said before, also doing this creates that cocktail of neurotransmitters, and it impacts our overall hormonal functioning. So our thyroid, every other kind of hormone in our system is impacted in a positive way when we have an orgasm. So I think it can be kind of not disputed that sex is good for you, but we have a lot more questions to answer and a lot more things to talk about before we can get there. So I'd like to flip the question a little bit and just talk about, is good sex for you, or how can we have good, satisfying sex that will lead to all these benefits and neurochemical changes? That's really kind of more what we need to discuss. So let's talk about sex. So this is actually easier said than done. I think, when we scroll through our Instagram feeds, when we turn on the television, when we really look at any media, there's sexually explicit images and content that we see. So we are a society that's pretty inundated with sexual messaging. However, when it comes to actually talking about sex, to talking about the nuts and bolts of sex, to talking about sex with our partner or our friends or family, we're not really taught how to do that. So we are living in what many researchers like to call a lewd prude society, meaning there's lewdness about sex everywhere, but when it comes down to actual real life sex, we don't really have language to discuss it. I see many folks in my office who come in and have sexual questions or concerns, and they tell me that they have never discussed this with their partner, with a friend, with a family member, or maybe they've only discussed it with one or two people because they're embarrassed. They don't really know how to bring it up. So I think it's hard in our culture to kind of just really have frank, honest conversations about sex. So we need to practice to make that better. And coming to talks like this is a good first step. On top of that, there's something else going on that we can see in the research, and that is called the pleasure gap or the orgasm gap. And you can see in this little graph who's having orgasms. For heterosexual women, so women having sex with men, 65% of them only reliably orgasm with sexual encounters. And lesbian women, so women having sex with women, 86% of them reliably orgasm. And with heterosexual men having sex with women, 95% of them reliably orgasm during sex. So I think it would be easy to look at this and say, well, I know what's going on here. It's simply that men don't know how to give pleasure to women, but it's really way more complicated than that. I'm sure many of you saw this article in the New York Times about the clitoris, and it kind of sheds some light into what I'm talking about. So it's really only been since 2005, so not so long ago, that we even really understood the anatomy of the clitoris, what it looked like, how it worked, where it was in our bodies. So if scientists aren't really studying women's sexual health and women's sexual pleasure, and we're not really taught about how to talk about it or how to explore it, then it's no accident that men and women alike don't really understand women's sexual pleasure. I think, like I said before, we'd like to say, oh, isn't this nice for men? But what we know with the research is that men aren't particularly satisfied with the kind of sex in this 65% of women orgasming situation. Men in committed relationships, or even just in uncommitted relationships, are really more interested than we might kind of stereotypically think they are in women's pleasure. So this is all really not working for most people. So what do we do about it? We can explore kind of different avenues of how to improve our sex lives and have more satisfying sex. So the first thing I'm going to do As a midwife, I have a specialized sexual wellness practice. So I see folks who have sexual concerns on a regular basis. So I'm going to go through kind of the most common ones and just talk about how we approach them and what they can teach us about women's sexuality. So something I see a lot of is people who have pain during sex. So obviously, if you're uncomfortable during sex, it's going to be hard for it to be enjoyable. So the first thing we want you to do, if this is an issue for you, is to see a provider. You need a really good exam. The exam is going to be more in depth than kind of a traditional pelvic exam. We're going to look at all your tissue. We're going to really feel all your muscles inside your vagina and kind of really hone in on where this pain is coming from. There are many reasons that you could be having pain during sex. One of them is an infection. You could just have a simple yeast infection or a bacterial vaginosis infection. You could perhaps have an STI, so we would screen you for those. GSM is genitourinary syndrome of menopause. Our vestibules, or the entrance to our vaginas, are fed by estrogen and testosterone. And when we are in the perimenopausal transition, so that 5 to even 10 years before our last menstrual periods, our estrogen, progesterone, and even testosterone decreases. And that can cause changes in our vaginal tissue that can lead to pain during sex. This is totally treatable. So if you think this is going on for you, you should definitely see a provider. Another thing that can happen is you can have pain with like different positions during sex, and that can kind of come out of nowhere. Sometimes as we age, or as we have babies, or even at different parts in our menstrual cycle, our uterus can be in a slightly different position in our body. And then if something is knocking into it, like a penis or a sex toy, it can be uncomfortable. So if that's going on, we can figure that out, and there are tips and tricks that we can do to help with that. Another thing that could be happening is pelvic floor dysfunction. So our pelvis is a bowl of muscles and fascia, and over time or with injury, parts can get tight or parts can get loose, and that change can sometimes cause pain during intercourse, and that can be fixed as well. One more thing I just wanted to mention is vaginismus, which is a involuntary tightening of the muscles of our vagina that can make it hard to have penetrative sex. So if that's going on, that is also completely treatable, and you would want to see a provider. We'd probably hook you up with a pelvic floor physical therapist. Same thing with the pelvic floor dysfunction. So most causes of pain are treatable, and you should seek help right away because they're usually fixable. Something else folks see us for is anorgasmia, which is just the inability to orgasm. Sometimes this is a new problem. Sometimes it's just been a lifelong issue. Both things are treatable. So of course, the first thing you should do is see your healthcare provider if this is going on for you. Sometimes there are medications that can be adding to this problem, some sort of health conditions that need to be ruled out. But most of the time, it's just a matter of re-education or just education. A lot of folks who come in, if you watch movies, the movies we grew up watching, you think that most women reliably orgasm with kind of that thrusting, penetrative sex. And that's actually not usually the case. About a quarter of women can reliably orgasm from that sort of, vaginal penetrative sex, that sort of stimulation, but 3/4 of women do not. So a lot of times if we just right size expectations and, help people understand that clitoral stimulation, other kinds of stimulation that lead to orgasm are just as valid and also ways to have pleasure, then when people come in thinking there's something wrong with them because they don't reliably orgasm during penetrative sex, kind of right-sizing those expectations can really help. Um, Another thing that happens is that folks just, for whatever reason, have never really learned how to have an orgasm. And that is just kind of giving people more education and tools so that they can figure out how that works. So if you think about it, male anatomy, it's kind of easy. There's one way, it's right out there. People kind of know how to reliably bring orgasm to male genitalia. We're not really taught how to give it to female genitalia. And women are a little more diverse in terms of how pleasure and touching affects them. So there's a picture here of the clitoris, and kind of the part that you see on the outside of your body is very small. And the part that is kind of hidden inside your body is much larger. So just learning about that and kind of learning how to access pleasure in different ways can really help people learn how to have an orgasm. Oftentimes we talk to people about figuring it out on their own first before they figure it out with a partner, because it is like a learned behavior. So oftentimes people feel more comfortable doing that on their own. Sometimes people have super supportive partners that help them as well. There are a lot of tools out there that folks can use to help themselves not only learn about orgasm, but just learn about female pleasure. And this is one that I recommend to everybody. OMG, yes, it's a website dedicated to kind of the exploration of female pleasure. It's very tastefully done, and it's different women, different bodies, different ages, talking about kind of their experience with pleasure. There are some how-to videos. It's just very instructional and very, very helpful for many people. So I highly recommend exploring that if this is something you want more information on. Another thing we see folks for is low libido. And of course, if you have this as a new onset problem, or if it's just been something you've been wondering about your whole life, first step is to see a provider. There are many medical causes, certain medicines you might be taking, sometimes during the menopausal transition. Low libido comes up. So we want to rule out anything kind of organic that could be causing this. But again, like anorgasmia, a lot of times, low libido is just kind of a matter of looking at things differently, or right-sizing expectations, or just getting more information about how libido works. So we have different kind of views of how desire and libido work. The traditional view is the one that we call spontaneous desire. I think that's kind of the one that is most in movies and kind of popular culture, is that we're just kind of hanging around. Something might stimulate us that's sexual. We see our partner, we see a sexual image, and we start to think, hey, like I'm feeling like I am interested in sex. And then we have sex with our partners, and then we have an orgasm, and then it's over with. So that's kind of the standard narrative of desire, the kind of desire we're all expecting to have. And for many folks, this is how desire works. We know that for men, 80 to 90% of men, this is how desire works. And for women, it's not always necessarily this way. There is now what we call an alternative cycle of female sexual response, which works a little differently. So how this works is a person will have a non-sexual reason for intimacy. For instance, they think, okay, I would like to engage in intimacy with my partner because I know it brings us closer. I know it, makes me feel good, maybe not in a sexual way, but in a way that helps me connect me to my partner. It helps my partner be more open and, connect with me. So a non-sexual reason to be intimate is the start of this cycle. So then you start to engage in intimacy. And as it's happening, as it's progressing, you might start to notice that your libido is kind of being turned on, that you become more interested in intimacy or sex or kind of connecting in that way. And then kind of the feedback loop increases. So you have sex, you enjoy it, even though kind of in the beginning you weren't that interested. One of my mentors likens this to going to the gym. So you wake up in the morning and you think, oh, I should really go to the gym. I don't really want to go to the gym. I'm just going to make myself go to the gym. You get to the gym. You remember how great it feels. You leave the gym and you think, oh, that was awesome. I'm going to do it again tomorrow. So that is similar to responsive desire. So I think understanding kind of how your specific desire works can be super helpful if low libido is an issue for you. Here are some resources. If you want to explore this more, Come As You Are is an amazing book by sex educator Emily Nagoski, and she gets into the nuts and bolts of all of this. This website, this podcast is by Carol Lowenthal. She has a lot of amazing content on there, but I recommend searching for the one about libido and sex, and that can help you kind of rethink this. Rosie is an app that you can install on your phone that just has tons and tons of information about female sexual health. So all ways to kind of dive deeper into this if this is interesting to you. Something else that Emily Nagoski talks about in her book is sexual accelerators and breaks. So this is something that's good to understand if you're kind of trying to switch kind of your experience of sex. So our brains are wired to live kind of in caveman times and ancient times. So when we're having sex, our brains are wired to scan the environment to see if there is a tiger that's going to come out of the woods and attack us. So if there are a lot of, there aren't any tigers now, but there are a lot of things that kind of interrupt our brains, right? So they could be things like screaming children, barking dogs, a sink full of dishes. So we really need to think about what our breaks are or what our turn offs are. And then also we need to think about what our turn ons are. So turn ons could be, an empty house, a clean house. The kids are away, the dog's not bothering us. So when we're kind of trying to enhance our sexual experience, we need to figure out how we can get rid of those things that are breaks for us and increase the things that are accelerators. So that can be helpful. Another thing we can think about is context. So our brains are very context dependent. We could experience the same thing in two different contexts and have different results. So if we're trying to optimize our sexual experience, we want to be in contexts that help us do that. So we can kind of imagine kind of the same stimulus or the same experience in two different situations. So let's go to the baseline irritated situation first. So you can imagine you walk in the door at the end of a long day. You had asked your daughter to put dinner on the stove. You had asked your son to pick up the toys that were all on the ground. None of those things are done. And your partner comes in the door and they snuggle up to your neck and kind of give you a little like sexually suggestive gesture. And you might say like, really, you too, you need something too, please just leave me alone, right? Then you can think about that same thing in another context. Say you're on vacation, you just finished a delicious meal with your partner, you're about to get in the hot tub, and your partner comes along and does that same little nuzzle on your neck. And you might think, oh, well, that's interesting. Like what comes next, right? So our brains are really wired to respond to context. So thinking about things that can increase experiences where our brains are more turned on can really help changing our sexual experience. Another thing to know about as we're talking about this is what our Nan Wise calls NRE, or new relationship energy. So when we are in a new relationship, our brains produce an amazing neural cocktail, again, almost like opioids. So that euphoric feeling of being in love, I'm sure we can all know what that feels like. And that's kind of lasts for about 2 to 3 years in the beginning of a relationship. Eventually, our brains get used to that stimulus. So the stimulus being our partner, and they don't produce those chemicals anymore. So things kind of feel different. For many folks, this can be disappointing. Some people might feel like they're not in love. And so it's just interesting for us to know that this is a real thing. It's neurochemically driven. And what generally tends to happen to folks is they go back to their set point of desire. So if they had spontaneous desire all along, they might continue to have spontaneous desire. It's not going to be like the same heightened response as when our brains are bathed in those neurochemicals, but it's going to still have spontaneous desire. If we were a responsive desire person before all this new relationship energy was there, then we're just going to go back to being a responsive desire person. And that doesn't mean anything about the relationship. It just means that those neurochemicals are kind of winding down. So also important to know. And someone who really talks about this a lot, and who I recommend to folks who are kind of in this long-term relationship situation, is Esther Perel. She is a sex therapist that really studies folks in long-term relationships. She has a great book called Mating in Captivity, and also a podcast where she interviews people in long-term relationships called Where Should We Begin? And what she talks about is if we're in these long-term relationships, we really need to rekindle eroticism. And eroticism, what eroticism actually means is it's not, this is from Esther, what she says, it's not sex per se, but the qualities of vitality, curiosity, and spontaneity that make us feel alive. So I think when we listen to that, we can all kind of imagine what that feels like. So in order to kind of rekindle that, if we've been with a partner for a long time, we need to do things that are erotic. So that doesn't necessarily mean sexual. It means be curious about your partner, do different new things with them, ask them questions that you've never asked them before, go on a trip with them, just experience new things, share erotic experiences that can be like a walk in nature, a delicious meal, things like that. So she has a lot more advice about kind of how to approach this. So I recommend delving into her information if this is something that resonates with you. Okay, so another thing just to know about, because I think it's super interesting. We kind of talked before about how gender is definitely on a continuum. Everything is not black and white. But when we study the difference between brains that are bathed in kind of the traditionally female hormonal cocktail and brains that are bathed in the traditionally male hormonal cocktail, there are a lot of differences. And I just think it's interesting to know about because it can provide us with some information. So hormones really do play a large role in our sexual desires and behaviors. Male brains have more testosterone receptors. So they're kind of receiving that spontaneous desire. They have sex on the brain more than the traditionally female brains that have more oxytocin receptors. Oxytocin is that neurochemical that is involved in birth and in breastfeeding and in kind of connecting and bonding with groups. So our brains just are wired differently. And of course, there are female brains that have more testosterone receptors and male brains that have more oxytocin receptors, certainly. But just in general, when you look at populations, this is what's happening. Also, our sexual interest can change with our menstrual cycle. I'm sure many of you have noticed that you have an uptick in spontaneous desire when you are ovulating, which is not an accident, right? Mother Nature wants us to procreate during that time, right? So that's kind of when our bodies are more turned on and receptive in that spontaneous desire kind of way. Something else that's super interesting to know about is the concept of genital non-concordance. So what that means is that when we'll talk about kind of male brains first, they have genital concordance. So if they are shown something that is sexually explicit, their genitals respond, there's more blood flow to them, they become erect, and their brains also respond in the same way. Their brains are turned on and say, like, they will say, yes, my brain is sexually interested in this situation. And their genitals say the same thing. When traditionally female brains are exposed to many sorts of erotic or sexual stimulation, their brains might perhaps say, no, this is really not interesting to me. It's not doing anything for me. But their genitals are having a different experience. Their genitals are there's more blood flow there, perhaps more lubrication. So female bodies could just be a little more complicated. Their brains and their genitals don't match up all the time. So that can be genital non-concordance. And I think this is important to understand because many folks come into my office and say, like, can I just get the female Viagra? Like, that would be what I would want. Unfortunately, the way that Viagra works is just by providing more blood flow to the genitals. With females, that providing blood flow to the genitals does not make us feel like we have more sexual response. Another reason why this is just interesting and I think important for folks to know, because many women who've experienced sexual trauma have had kind of physical signs of arousal. So blood flow, lubrication, even orgasm, when their brains are saying, no, this is a terrible situation. I don't want to be in it. So that's just kind of very validating for folks to know that our brains and our bodies can do different things. Just interesting things to know kind of when we're trying to understand our own neurobiology. So a quick review of that part of the talk. Sexuality is not a drive. There's no on-off switch. Responsive desire is just as healthy and normal. Our arousal system has both accelerators and brakes. So things that turn us on and things that turn us off. So we need to focus on removing the things that turn us off and increasing the things that turn us on. Sexual sensation is context dependent. So how can we cultivate context that helps improve our sexual response? And sexual experiences change as relationships evolve. So that being said, let's turn to some evidence-based practices that we can use to improve our sex lives. The number one thing in the literature is communication with our partners. And like I talked about before, this can be hard for some people depending on how we were raised, what kind of messages we were given about sex from either our parents, our community, perhaps a religious community. It can just be, and kind of also what patterns we've already set up with our partner. So I recommend that you approach this kind of the same way you would approach any conversation, right? Ask your partner, is now a good time to talk? If not, find a different time. Use I statements, use open and honest language. Don't be afraid to be vulnerable. If this is just kind of beyond what you feel like you can do, working with a therapist or a sex therapist can be helpful. There's also fun games that you can look into. This deck of cards, they're called intimacy cards. You can actually buy them on Amazon. They are quick questions that you can ask your partner, like alternate asking questions, which can be fun. There's also an app put out by the Gottman Institute, which the Gottmans are relationship therapists. And they have an app with questions that are made to cultivate intimacy. And there's one specifically related to sex. But I think just talking about things that you haven't talked about with your partner can really kind of open up new avenues. Another thing that's been great as of late, I think there is a lot more curiosity and research going on in terms of kind of the reality of sexuality, especially in women. So here are some things that you can just explore either on your own or with your partner if you want just more language or more information about how to approach talking about sex. So this first one, How to Build a Sex Room, is on Netflix, and this woman is a trip. Her name is Melanie Rose, and she is a interior designer, but she also kind of moonlights as a sex therapist in this show. And she meets with different couples and talks to them about their sex lives, about their desire. And she helps them build, like renovate kind of a room in their house that they can then use to dedicate to sex. So it's really just a fun thing to watch and kind of just see how different people work through sexuality. This next movie, it's called Good Luck to You, Leo Grand, is amazing, and I recommend that everyone watch it. Emma Thompson plays a woman whose husband has recently died. They had been married forever. She had never had an orgasm, and she hires a young male sex worker to help her out with that. And it's just a great celebration of midlife sexuality and female pleasure, and it's done in such a sex positive way. I think it's great that we kind of have this sort of stuff in our popular culture now. This next show, Good Sex, is on the Discovery Channel, and you can get it on Amazon Prime if you subscribe to that. And Caitlin V is a sex coach who helps different couples through sexual challenges. And it's just an interesting way to kind of see how different people work through their sexual concerns. And she has great advice and is very sex positive and focuses a lot on female pleasure. And then last on this list is this Netflix documentary, The Principles of Pleasure. It is focusing on what I talked about before, the pleasure gap or the orgasm gap. And it's just a bunch of experts talking about female pleasure and kind of the research, what we know, what we don't know, and kind of where we can go to get more information. So I recommend that as well. The best intervention that we can do to improve our sex lives in kind of the research is having to do with mindfulness. So here are two books that you can explore more if you're interested in this. Laurie Brotto is a psychologist who studies female sexual desire and also mindfulness. And Good Sex is written by a meditation teacher. So both of these have a lot of great information in them. So first off, what is mindfulness? Mindfulness is non-judgmental, present-centered awareness in which each thought, feeling, or sensation that arises in the body is acknowledged and accepted as is. So we live in our multitasking brains, right? We're off doing 10 million things at once. We are often kind of really in our heads, thinking about what we need to do today, what we need to do tomorrow. And mindfulness helps get us back into our bodies. So that can be something that has been super helpful for many folks. And what Laurie Brotto says is the reason mindfulness is so great, we can think about like both that genital non-concordance concept that I introduced, as well as that responsive versus spontaneous desire. And the reason mindfulness is so great is because we don't have to manufacture desire out of thin air, meaning we don't have to like make up desire that's not there, right? We just need to drop into the sensations in our bodies that are already present. So what mindfulness does is helps us connect our brains to our bodies. We might be experiencing sexual pleasure or like kind of erotic feelings in our bodies that we don't even know because we're living in our brains. So how do we do this? Lori Brotto had a great study where she took many women and had them have mindfulness-based cognitive therapy for 8 weekly sessions. So kind of just introducing the concept of mindfulness and teaching women how to really do these sort of mindfulness meditations. And then they practiced them daily for 10 to 30 minutes and started to practice having mindful sex if they had partners. And all of them showed improvement in sexual satisfaction, which was still present at 12 months. So this is a pretty amazing intervention, actually, with good long-term success. So it's definitely something worth looking into. And it even works for folks who are having pretty satisfying sex to kind of increase that satisfaction. So how does it work exactly? I can talk about this briefly, but then I recommend if you're interested, you can get either one of these books. Lori Brotto also has a workbook that you could work through to look on this. She has some stuff on YouTube that you could just listen to. I think many of us are aware of mindfulness meditations. There's some apps that can help you through it, like the Calm app. But really what you do, we'll talk about kind of each of these briefly, is just really kind of focus in on your body. So like for the basic breath awareness, you can kind of, if you want to do this now, you can just close your eyes and start taking deep breaths in and out and in and out. And fill up your belly with that breath and let it go. And just try and find where your breath is the most present for you. It might be on your nostrils. It might be in your chest. It might be in your belly. Find that place and just focus on it. Pay attention to how it feels and continue to breathe in and out with focus on that spot. So that's kind of a example. And it sounds kind of woo-woo if you're not used to this when I'm explaining it, but really kind of all brains benefit from this sort of practice. Another one can be rest and relax. So just kind of lay down and figure out which part of your body is the most relaxed and focus your energy there and just pay attention to that, then move on to a different body part. A pleasure boost is something that you can kind of begin to explore to figure out what sorts of things bring you more pleasure. And this shouldn't be approached kind of with the goal of sexual pleasure. It could just be approached with kind of feeling what kind of touch brings you pleasure. So laying down and touching your body in different ways, or having a partner touching your body different ways, and really kind of focusing in on what feels good. With a partner, you can do something called a mindful hug, where you set a timer for 3 minutes, give them a hug, and then focus on, you can either focus on your breath or do that pleasure boost where you're focusing on what feels the best. And with practice over time, this can really kind of flip a switch in your body and really kind of change how you are experiencing intimacy. Let's see, how are we doing on time? All right, I want to finish up quickly so we can have time for questions, but people always ask me about sex toys. So we're just going to do a brief overview of some of the things we might recommend in our practice. So first off, there's this magic wand, which I'm sure many of you have heard of. It's just kind of a standard vibrator for the clitoris that provides like direct stimulation and can really help folks kind of hone in on what that feels like and have an orgasm if maybe they haven't before, or just kind of add to what's happening already. Lube can be a game changer. I think we kind of have a cultural expectation that lube is just for folks who might need like the additional help. But really, I recommend that everybody try lube, especially silicone-based lube, because that lasts longer. You don't want to use silicone-based lube on silicone toys, but using lube can really kind of just change the sensation of what intimacy can feel like. Other things, this is kind of the vibrator that has all the bells and whistles. This rotates, this provides some clitoral stimulation. So that's kind of next level situation. This is also something that can be used as a vibrator. The top part goes under clitoris. The bottom part goes inside and stimulates that kind of internal clitoris that we were talking about. Some folks use this during intercourse so that they can stimulate their clitoris and kind of have that penetrative experience. This provides some suction on the clitoris. This can go over the penis and provide some vibration. These are called Benoit balls, and they are, you put them in the vagina, and they are weighted balls. They have kind of weighted balls on the inside that move around, and the string hangs out like a tampon. And these are useful for kind of like helping you feel sensations in your vagina if you're not really used to feeling sensations in your vagina. Some folks have used these who want to learn how to have a vaginal orgasm. So you put these in basically, and you can kind of just like wander around the house or hang out and kind of feel what it feels like to have a sensation in there. And it can just kind of turn on those neural pathways in your body and kind of make you more aware of what's happening in your vagina. Some people like to use eroticism or like erotic literature to help them kind of get in the mood. This nut is you put this sleeve. If you're having pain with intercourse, perhaps because a penis is bumping into your cervix, you can have your partner with a penis put this on the penis, and it keeps the penis from going too deep inside and bumping your cervix. Let's see, last but not least, these things on the top are not made for sex, but they are called dilators, and we use them if folks have difficult with penetration, maybe because of vaginismus, like I talked about before, or after cancer treatments or surgeries that have changed the shape of their vagina. So those are some fun things just to know about. So in conclusion, just some of the last tips or tricks. Obviously, if you have pain, or really any concern that could be medical, please get evaluated by your provider. You want to, if you're kind of just interested in exploring more about your own sexual response, sometimes it's helpful to do that out on your own at first and then communicate it to a partner. Practice communicating with your partner what you like and what you don't like. You can play something called the 3-minute game for this. This is when you and your partner take turns. You set a timer for 3 minutes. You direct them on how you like to be touched, not in a sexual way, but like rub my shoulders down a little more, like stroke my arm, things like that. That can just get you able to communicate better with your partner. Understand your desire type. We talked about that, spontaneous versus responsive desire. If you have more of a responsive desire style, many folks have found that actually warming up before sex can help them kind of meet their partners right in the same desire level when they start. So some folks will like maybe have an orgasm with a vibrator before sex, or do something that turns them on before sex, like reading something sexy, watching something sexy. That can really help. Understanding your accelerators and your brakes, make a list of these things, share them with your partner. If you have, we used to kind of joke in the sexual wellness, sexual medicine realm that a new partner is the only evidence-based practice to increase a woman's libido. We know there are more things, but just to kind of know that, you know, if that's a possibility, then great. If you're in a long-term relationship, then that you're happy. And just remember that new relationship energy is a thing. And you can shift things by introducing eroticism and novelty, a la Esther Perel, to help with that. And most of all, this should be fun. And celebrate kind of where you've come from and where you're going. And also, I hope that all of you, since you're here, will kind of change how we approach women's sexual health in our world, and talk to your friends and your daughters and your sons and your partners and your sisters about all this stuff, so we can really just become more comfortable in making women's sexual pleasure a priority. All right, now I have a resource list that I'm happy to share with folks. So myself and my colleague, Vanessa Ross, at Baystate have a sexual wellness practice. Here is how you can get an appointment. If you call, just make sure that you let them know that you are interested in a sexual wellness or sexual health appointment, because we're closed to GYN patients in general, but we always take sexual health patients. And there is my email. Feel free to contact me if you want a copy of the resource list, or just if you have any further follow-up questions. Obviously, I'm super excited and love to talk about this topic, so I would love and welcome emails. So with that, I'll pause for a second on here, just in case anybody wanted to write that down or take a picture or whatever. And then I'll stop sharing and we can get to your questions. I think we have some time still, so that's great.
Amazing talk, Carly, and great help, I think, for women to get this information, and great resources.
Yes.
Really wonderful. I'm so excited.
Good. Yeah, there's a lot of stuff out there now. You have to sift through Google to find it. So it's nice that we created this resource list that I'm happy to send to people.
Excellent. Thank you.
All right. Let me,
yes.
Okay. Here's some
a few questions.
We have a few questions. So let's see. The first question is, does the brain light up the same for men and women during orgasm? Yes. So the brain kind of exercise, or the big brain event, is the same for both men and women. Okay, now you guys had to ask me. Lots of people really want to know the name of this Gottman app. So let me just pause, because it is on my phone, but don't remember the name. Okay, it's called Card Decks, and Gottman Card Decks. It looks like that. Oh, I guess there's a lot of glare, but just Gottman Card Decks in the App Store. And when you go on it, there's all different kinds. It's not just for sex. It's really like kind of evidence-based questions that improve intimacy among people. Let's see. I can't scroll down. Is there one more question there? A lot of people want to know the app name. Can you see the last question, Sue?
Yeah. Yep. There's just a couple of comments, really.
Okay. Here we go. I got it. Hold on.
Okay, great.
No, maybe not.
Oh, well, anyway, there's a comment saying really great information with a number of exclamation points. And then
here we go.
Do you see it now?
Okay. This is a great question by Camille. Okay. Do I have a favorite resource for pleasure-oriented sex ed for teens? No, I do not. However, I have contemplated, I have teenagers, I do think that OMG Yes is age appropriate for older teens. And I have thought about showing it. I have a son and a daughter, showing it to both of them. It's not presented by teenagers, obviously, but it's all different kinds of women. And it's very tame. Like it's age. I think it would be age appropriate for teenagers. I don't know if anybody in the audience has any other suggestions for that.
Robin says, great presentation. She appreciated it too.
Thanks everybody for coming. Reach out to me if you have any more questions. Feel free to call our office for an appointment. Thank you. Yeah,
it looks like that was it for questions, but you clearly made yourself accessible. So thank you for that. And thank you for your time and expertise. I'm so thrilled to share this recording and future content. So thank you, Carly. And thank you to the audience for joining us tonight.
Thanks, Sue. Thank you, everybody.